volume.
Hello everybody, I'm Dr. David Feldman, the gastroenterologist for the consumer of healthy medical care. Okay, so I get asked a lot, what's the difference between tablets, caplets, capsules, powders, liquids? Which one should I buy? Well, today I'm going to talk to you, give you some tips on what's the difference between all of these. So first we're going to talk about tablets. What's the advantage of the tablet? Well, the tablet is low cost. It's the most cost-effective per medication dosage. And it's also available in many different potencies, and it has a relatively long shelf life. But the disadvantage is it may be hard to swallow for some people. So next we're going to talk about caplets. Caplets are easy to swallow. So what's a caplet? A caplet is just a tablet that's a smaller size and has a smooth coating. So they're easy to swallow. Next I'm going to talk about the chewables. So the chewables, they tend to cost more. They tend to be lower potency, and sometimes they have in them, or I should say most of the time, they have a sugar or flavor added to them. So those who are watching their sugar, a chewable may not be for you, but could be for children. Next, I'll talk about powder. So powders are very cost effective. Why? Because you only use as much powder as you need for the dose you're looking for. They tend to be, the powders, they're the least convenient. You have to mix them with liquid, and the advantage is you do have flexible dosing. Next, folks, I'm talking about capsules. So capsules, they're made of 2 pieces of gelatin put together. The medication's put inside. The main advantage is they're easy to swallow. You have an ability to open up the capsules, and you can put them in, let's say, applesauce or something. So they may be good for somebody who has difficulty swallowing. You could open up the capsule, or for children also who may not be able to swallow. You can put it in the applesauce and they'll eat the applesauce. They tend to cost more than tablets. They have some space and potency limitations, and they're not airtight, so they do have a short shelf life. Next, I'm going to talk about the gels. Okay, the soft gels, they're 1 piece of gelatin. They're a capsule, they have a smooth contour and shape, and they're easy to swallow. They have a superior shelf life, and that's because they're completely sealed and airtight. The disadvantage is they have no flexible dosing, and they are also much more expensive. Gels, yes, gels are much more expensive. Next is liquids. So liquids, some people think that the liquids absorb faster, and they want the liquid because they think they're getting it quicker to, it's quicker to work, but that's not necessarily true. And it's not clinically useful. The liquid usually, even if they do absorb a little faster, it's not usually that much more. They're always more expensive on a dollar per medication basis. They have very short shelf lives, and of course they're heavier to transport. And another problem with the liquids is the ingredients tend to settle to the bottom. And even if you shake them, you may not be getting an equivalent dose of the medication in each dosage of the liquid that you put together. So that's it, folks. That's my practical tips for the healthcare consumers. A short lesson on the differences between tablets, caplets, capsules, chewables, gels, liquids, and powders. Thanks for listening. Bye.